I'm Dr. Sanjeev Gulati, Director Nephrology and Kidney Transplant, Fortis Group of Hospitals, NCR. Today I'll be sharing with you 7 myths about diet after kidney transplant. I have experience of about more than 4,000 kidney transplants, and I've seen that amongst all things, the diet is perhaps the most misunderstood aspect about kidney transplant. It is also partly due to the fact that we kidney doctors don't spend enough time talking about diet, and also most of the nutritionists or dietitians that you encounter in the hospital are not specifically trained because of any lack of any training programs about dietitians in kidney transplant. So let's discuss these myths one by one. First, I must drink 5 to 6 liters of water daily. I think this is a very common problem that I see. Yes, immediately after kidney transplant, we do encourage all our patients to drink a lot of water because there are a lot of solutes that are being there in your body and they need to be flushed out. But as time passes, then we'll allow you to restrict your fluid or limit your fluid intake to about 2.5 to 3 liters daily, and we discharge you on that. So, beyond a week, you can take a minimum amount of 2 to 2.5 liters and you can do well. There is no need to push yourself to drink about 5 to 6 liters of water. I have seen patients having a miserable time getting up at night trying to drink water, which is certainly not easy. So I think again a minimum of 2.5 liters and to a maximum of 3 is all that you require. And this includes all liquid intake. So you could include water, you can include tea, coffee, other beverages also. Second, I can eat only boiled food because of risk of infection. This is untrue. You can eat regular spicy food. A lot of these patients are under great misconception that the regular home food is unhealthy. It is absolutely untrue. So have a lot of food which is healthy but which contains regular amount of spices. There's no need to torture yourself eating only boiled food. Third, I can eat raw fruits and salads. Yes, in the first month post transplant, we do restrict raw fruits and salads because anything that is raw, that is uncooked, carries a risk of infection. So after first month after transplant, you can certainly eat raw fruits and salads properly if they are washed properly and if you are taking them from home. Don't take the risk of eating raw fruits and salads from outside because the risk of infection remains. Fourth, I should not eat high protein diet. This is another common myth. During the phase of chronic kidney disease, a lot of patients are on protein restricted diet. But the moment you get a kidney transplant, your kidney function is back to normal. In fact, your kidney is in a phase of regeneration and your rest of the tissues also need to heal itself. So you should take a normal amount of protein diet. We say about 1 gram per kg per day. In fact, you are at a risk of infection. So if you restrict protein, you are likely to be at a higher risk of infections. So take a good amount of protein in your diet. Have fish, chicken, eggs. Fifth, I should take normal salt in the diet. Most patients have high blood pressure post transplant. Hence, we generally advise them to restrict salt in their diet because the higher amount of salt you take, the more likely your blood pressures are going to go up. Also, a lot of our immunosuppressive medications contribute to high blood pressure. So I suggest to all my patients that you should take low sodium salt like Lona salt or Tata Light as they have low amount of sodium. Other than that, your diet is going to be no different from what your family members are going to eat. Sixth, I cannot eat outside food. I think this is one of the commonest problems that limits a lot of transplant patients in their lifestyle. Only in the first month post transplant, there is a limitation on outside food because we are not sure about the quality of food. But beyond first month post transplant, you are free to have outside food if it is cooked properly, if you are taking it from a place which is hygienic. I tell them a simple rule that if you are going out to eat once in a while, go to a restaurant who obliges you, and if you have ordered a dish, you can ask them to heat it or boil it again. So just like you boil water, it destroys germs. So any dish that you order which is piping hot, which is boiled again, that carries less risk of infection. Again, if you are taking baked items, tandoori items, because these items are subjected to very high degrees of temperature, so there is minimal risk of infection. So anything that is freshly cooked, which is hot, it is safe to take. But at the same time, please do avoid salads, chutneys, curd preparations when you are eating outside. But certainly do not limit yourself, because I can understand that if you are traveling, it becomes very difficult to carry home food. And yes, it is safer to have hot food from a place which serves hygienically cooked food. Seventh, and I must only drink mineral water. I think this is again untrue. We all know that there is a risk of infection if you drink water which is unsafe. Our idea is to make sure that you should drink safe water. During the hospital stay, yes, mineral water is served to you, but that does not mean that when you go home you are going to take mineral water only. You can take water that is boiled. We have been using it for years together. Water that is coming from your RO or AquaGuard that has been installed at your home. So as long as you take clean water, it is fine. Yes, if you are going outside to a restaurant for meals, obviously I would advise you to take mineral water. So if you follow these 7 myths, and if you follow these 7 tips, I'm sure life is going to become easy and enjoyable for you following kidney transplant. If you like this video, please subscribe to my YouTube channel, The Kidney Clinic. Thank you.